Welcome back to the Pulse. You know, May is actually Stroke Awareness Month, and the ABC Brigade has started 2 new programs for people who have been diagnosed with aphasia and with stroke. And we want to talk a little bit about that now. And joining me now is Kathy Howard. She is the founder of the ABC Brigade. Kate Engel, she's the lead speech pathologist at the Rehab Institute of St. Louis. John Richmond, he's an aphasia patient, and Dr. Ashish Nanda, a neurointerventionalist with the SSM St. Clair facility. Thank you all so much for being here.
Thank you.
Kathy, let's talk about the programs. What's going on? You're always coming up with something that's really exciting and great for our patients. So what's going on?
I am really excited about this. We've been doing, we started a program about a year ago called Coffee Cafesia. And I've been informed by the aphasia patients that a person that doesn't have aphasia has a hard time saying it. But we meet every week, and Missouri Baptist Hospital actually donated space to us. We simply provide coffee and snacks and anything that they ask us for. We've added games. We've got a hot rummy cube table that's always going. We've added some reading materials. It's not therapy. We just say it's therapeutic. And it's just 2 hours of coffee and conversation, basically, for anyone with aphasia, not just from stroke, anyone. And they just come practice talking and meeting other people. It's strictly a social thing. And our second program that we just started last night is, we call it the Aphasia Bridge Chorus. And it is a chorus for people who have aphasia. And we're just at the beginning stages of that. So we're hoping to just meet monthly to begin and put together beautiful sounds.
Oh, that's awesome. So they sing.
Yes.
Oh, that's awesome. John, what do you think about that program?
I can't do anything, but it works.
Yeah.
Yes.
Oh,
I'll
that's
do okay.
awesome.
Yep.
Yeah. So Dr. Nanda, just fill me in and tell me, first of all, what is aphasia and how is it related to stroke?
So aphasia is difficulty in speaking or understanding someone's speech. It could be 2 different kinds. It could be receptive or expressive. In expressive aphasia, a person cannot express the words outright. And in receptive aphasia, they have trouble understanding someone else's speech. In majority of the patients, the speech center of the brain is involving the left side of the brain. And in some certain patients, it could be the right side. Now again, on the left side, there are 2 centers. One is the receptive center and one is the expressive center. So depending on what part of the brain is involved would determine what kind of aphasia the underlying person can have.
So is what causes the aphasia?
It's the damage to those centers of the brain that help to form speech or help to understand the speech.
So does it typically happen to patients who have been diagnosed with stroke or who have had a stroke?
Yes, stroke is one of the leading causes to have aphasia. There could be other causes, but in patients with stroke involving the left side of the brain, they can end up having receptive or expressive aphasia based on what part of the brain on the left side is damaged from the underlying stroke.
So John, did you have a stroke first and then you had aphasia?
First. I had this one right here, 100%.
100%?
Yes. So this one now it's changed, do something else. So it's okay. At first I couldn't do anything. Like this one, nothing. I said, oh, okay, look.
Now you can move.
It's fine, yes. Now it's okay.
Any golf now?
Yeah.
You golf now too?
No, I could putt. Barb was my wife. She hits the ball, I could putt. That's it. So.
That's awesome. So Kate, just fill me in and tell me about when you work with patients that have aphasia, what do you do to help them regain their voice and control of their voice?
A lot of times it's about giving them other opportunities, other ways of communicating. So whether that be using a communication book, encouraging them to use gestures or point. We oftentimes get the families involved as soon as possible because they know the patient better than we do. And it's just about finding their voice in any means necessary. So a lot of patients, they'll bring in picture books and they can show us, how to, or show us about their family without even using words. We encourage patients to use gestures to communicate their wants and needs. So if they want something to drink, how to communicate that. And we also just provide that support, you know, kind of acknowledging that it is frustrating beyond belief to not be able to communicate.
I use it, everything, yeah.
What do you use?
He uses
I can do anything.
he
I
uses
can
a
write.
notebook.
So you
It
write
works
things down.
really good. I could do, yeah. I could do the whole thing, like this one. I could write. It's good.
A lot of
Yeah.
patients, they may not be able to speak, but they can
Right.
write. Some patients can't do any of those
Sometimes
things.
they don't. Yeah,
Yeah.
it's good.
But that works well for you to write
Yes,
things
it
down,
does.
John?
I have to. Sometimes she said, "Stop it! I can walk." So I said, "I can't do it then." So
Right.
it's okay.
Yeah.
Sometimes they need a lot of encouragement,
Right.
you know?
Uh-huh.
They need that confidence that to at least try, because if you don't try, it's not going to get better.
Right, right.
And so by trying, you're kind of reorganizing that brain to help you pull out the words a little bit easier.
So do they ever regain their voice the way it was
Absolutely,
yeah.
before?
Really
Some-
good. Some of
Yeah.
the guys, a long time. So he's 6 or 7, long time. But it's okay now. It's sort of, it works.
Right.
So typically, you know, I would say it's unlikely that they're going to get 100% back, but if we can get them to a point where they are able to get back to their life. And that's what's so great about Kathy's program, is that she encourages them to just participate in their community. And that gives them an opportunity to talk with people who also have
And it's
the same
safe.
Yeah.
It's safe for them, because I know when they come in, and one of the reasons I asked John to join us today is a lot of times when they come in that first time, they are so nervous. They don't have their words. They don't know what they're walking into. And John walks right up and says, "Hi, I'm John. I have it too," you know. And immediately, and he gets them to a table, you know, and he's very welcoming. And once they're there, it's like they've got their own little thing going. It's a lot of them
Yeah.
now travel together, or they go to dinner with their, you know, spouses, and
I could use a car. That's a big deal.
Oh, you need a car?
Yeah, that was a big deal.
Yeah.
Yeah.
All right. When we come back, I want to talk, Dr. Nanda, about diagnosis and treatment and that kind of thing. So stay with us. We'll have more on the conversation when we come back.